turn now to our special ongoing series we call Undercovered. This week, we're focusing on battling addiction.
NBC News investigative correspondent Ronan Farrow is here. He's looking at stories that are tied to the war on drugs, and you don't always see these ones on the headlines. Ronan, good morning to you.
It's good to see you guys. You know, we're really at a turning point in terms of how America addresses drugs and addiction. Just a few days ago, Attorney General Jeff Sessions ordered harsher sentences for drug offenders. But some states and cities are pushing back with approaches that emphasize treatment rather than criminalization. America's opioid epidemic is claiming more lives than ever, often in public places.
People are in doorways, shooting up, dying in alleys.
John Urquhart is the sheriff of Seattle and surrounding King County, where someone dies from an opioid overdose every 36 hours. And where officials are about to try a radical new response.
Take the problem off of the streets, around here at least, and put it in a safe environment.
He's talking about safe injection sites, where addicts can openly shoot heroin and other drugs under medical supervision.
They're not going to overdose. If they do overdose, there'll be treatment there, and they can talk to people about what their treatment options are.
Seattle and King County launched a task force to look at the crisis and are now acting on its recommendation to open the first 2 safe injection sites in the country. Tell me your reaction when you first heard this idea was being floated.
My reaction was, are you kidding me? This is a terrible idea.
And what changed your thinking?
The war on drugs, the fact that it didn't work. So what are we going to do differently?
The war on drugs, kicked off by President Nixon in the 1970s, started a trend of tough laws that lock up drug offenders. More people are now incarcerated for drug crimes than for violent crimes, disproportionately minorities and poor people. And spending on drug control has increased for decades. But addiction rates have stayed constant.
We're just starting to quit looking at drug abuse as a police problem and look at it as a health problem.
County Health Officer Dr. Jeffrey Duchin was part of the task force. Some people are going to hear about this concept and find it completely crazy.
Well, we're considering this a public health crisis. It makes a lot of sense from a public health and medical perspective.
He says safe injection sites have worked elsewhere. Here in the heart of Vancouver's Skid Row, officials opened a safe injection site called Insight in 2003. Every day, 700 users come in, get clean needles, choose one of these stalls, and shoot their drugs. More than 4,000 people have overdosed. Not one has died.
This is kind of a before and after picture of me. This is when I was actively using drugs, and this is me now.
Guy Felicella says he came here thousands of times and overdosed 5.
This is where I overdosed here, and I was on this floor right here. A nurse that, through her interventions, brought me back to life, and it was after that that I made the decision to seek treatment options and change my life.
Today, he's 4.5 years sober and happily married with 2 kids and a full-time job.
When I was ready, they were here to help me. Compassion is one of the greatest gifts of the world.
Similar sites are operated across Europe and Australia, and some experts say they're working. Dr. Sarah Wakeman of Mass General wrote The Case for Supervised Injection Facilities in the New England Journal of Medicine.
We've got very promising evidence from other sites in other countries that show this is a piece of the broader strategy.
But many people think this is a bad idea.
What happens is you bring more addicts to your location.
Gretchen Taylor is a member of the Neighborhood Safety Alliance of Seattle. For her, this is personal.
I'm the parent of an adult ongoing heroin user.
What do you say to parents who say, I too fear for my child, and I think this might save them?
I want that to be true. And the truth is, I don't believe that is true.
A new bill introduced in the Washington Senate seeks to ban the safe injection sites. State Senator Mark Milosha is behind it.
What they've done in Canada is basically legalize heroin use. Safe injection sites are a deadly idea.
And with new Attorney General Jeff Sessions pushing a tough law enforcement approach on drugs, there are questions about how the federal government will react. The Controlled Substances Act prevents setting up places like this where you got people using drugs inside. Could you be in the position of asking your officers to enforce illegal activity here?
There's certainly a good argument that the officers can't be charged federally. I'm not going to let our efforts here locally be dictated what the federal government may or may not do.
Our new Attorney General is more about law enforcement approaches to drugs and less about public health approaches.
That's probably true. I think that's a huge mistake. Is it going to work? I don't know. But it's better than doing nothing. And that's what we've done for too long, is we've done nothing except try to put people in jail that absolutely doesn't work.
The Department of Justice did not comment on this story. It's likely to be on the radar soon, though. There are safe injection sites being considered in San Francisco, Philadelphia, Massachusetts. New York actually recently appropriated funds as well to study whether we should have one right here.
This could get a debate really going because I think there are a lot of different sides to whether or not this is a good idea.
It clearly works for saving lives, as we were discussing while we were watching this, but the broader impact on the communities these go into is really, yet to be decided.
And there are going to be some people who just can't get their head around the idea of trying to stop people from doing drugs by giving them a safe place to do drugs.
This is the crux of the whole drug war debate. We have an administration launching a tougher criminalizing approach. There are people who say that's right. There are other people who say you just mitigate the downsides.
Wow. What do you have tomorrow? Because we're still focused on the war on drugs.
That's right, and this is another big controversial one. You may find it surprising. We looked at rehabilitation centers that are using marijuana to get people off of heroin, to get them off of harsher opiates.
Well, you've got some doozies this week. All right, Ronan, thank you.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.